In this video, we'll talk about horizontal jaw relation. Horizontal jaw relation, it is the relationship of maxilla and mandible in horizontal plane or anteroposterior direction. Now further, in horizontal jaw relation, we have two types. One is the centric relation and the second is the eccentric relation. Eccentric relation further has protrusive and lateral records. In lateral, we further have right and left. Alright. Now coming on to the centric relation. What is centric relation? The definition of centric relation has to be remembered as it is. So according to GPT-5, it is the maxillomandibular relationship in which condyles articulate with the thinnest avascular portion of their respective disc with the complex in anterior superior position against the slopes of articular eminence. This position is independent of tooth contacts. This position is clinically discernible when the mandible is directed superiorly and anteriorly. It is restricted to a purely rotary movement about the transverse hinge axis. Alright, now there is one more term which is maximum intercuspal position. It is the complete intercuspation of opposing teeth independent of the condylar position sometimes referred to as the best fit of teeth regardless the condylar position. Now, what is the significance of centric relation? First of all, it is learnable, repeatable, reproducible, and does not significantly change during lifetime. Now, what is the relationship between maximum intercuspal position and centric relation? Maximum intercuspal position and centric relation should not coincide in the normal dentation. It should coincide in the when we give in the dentures. Yeah. Alright. Then for neuromuscular proprioception. Now, whenever tooth has to go from one eccentric relation to another eccentric relation, it first has to go towards a centric relation. Alright. Then fourth, the muscles of TMJ are arranged in such a manner that first they will go to the centric relation and then they will go to any eccentric relation because it provides them ease and it is easier to produce. Then this position can be produced whenever the patient is trained accordingly. Also, dentures should be constructed with centric relation in view, because then only most of the movements can be performed. Then it helps in establishing centric occlusion, functional movements like swallowing, phonetics. Best position is centric relation, most unrestrained position. Then also helps to adjust condylar guidance in order to achieve balanced occlusion. Now, there is one thing that is retruding the mandible. Now, the patient has to be trained to retrude the mandible because all the records are taken when the mandible is retruded. So, there are two types. One is the passive method and one is the active method. In passive method, we basically give the dentist gives the instruction to the patient and the patient performs the movements himself. That is no active participation of the dentist. Whereas in active method, there is an active participation of the dentist. All right. Now, the instructions are relax, pull the jaw back, close on back teeth, get the feeling of pushing upper jaw out, and close on back teeth. Touch the upper denture with tongue and close on the lower denture. Then swallow and close. Tap the occlusal rim repeatedly and rapidly. Tilt the head back while performing these exercises. Protrude and retrude the mandible repeatedly. Alright, now in active method, the dentist places thumb and forefinger on patient's chin to exert a mild posterior force when patient closes on rims. Then second, which is mostly performed, dentist palpates temporal and masseter muscle to relax them. Third is the Dawson's bimanual palpation. In this, the dentist stands behind the patient, fingers on lower border of mandible, thumb over symphysis region. Now, the patient is instructed to open, then close slowly. Dentist applies a force on through the symphysis region quite posteriorly. Alright, the dentist applies upward lifting force and then applies simultaneous downward force by thumb on symphysis region. Then the patient is guided to retrude and to close on the centric relation. Now, there are certain difficulties in retruding of mandible. Difficulties in retruding mandible. There are of three types. One is the physiological, mechanical, and psychological. Physiological and mechanical are same. Biological. Biological, when there is loss of muscle coordination. Patient closes habitually in protruded relation. Alright, then physiological and mechanical, when there is a decreased adaptation of record basis. Psychological, when the patient is unable to follow instruction due to anxiety or stress. Now, coming on to the methods for recording the jaw relation. Three types: static, functional or genuine, and graphic. Now, wax occlusal rims. Now, this is the most commonly used method. In this, what we do is we contour and then we establish the video. Rim contoured. Video is established. Then we ask the patient to retrude mandible and we seal in such a position. Now, sealing can be done by heat or it can be done by pinning. It can also be done by nick and notch method. Heat in this hot wax knife is taken and the wax is melted and flow is done and in the junction of the rims. All right. Then in pinning also what we do is we take the warm metal staples and then we in the premolar area, very important to remember, P for pinning, premolar area, we pin them. But in these both the methods what we see is they're not recommended because they can lead to the burning of the lips, cheek, mouth, burning of lips, cheeks, mouth. Also, very important point, no equalization of pressure. Also, difficulty in preventing movement of rims while sitting. Now, nick and notch method is the recommended method. In this, what we do is in maxillary occlusal rim, that also molar region, we give V-shaped notches. V-shaped notches. Alright, then we take a trough. Now this trough is filled with soft wax, ZOE, impression paste, or quick setting plaster. This trough is placed on mandible. Alright, now when we basically record the material, so we load it and the occlusal rims are inserted into the mouth. Then recording material, we put in the recording material and then the material sets. Alright, now after wax occlusal rims, the another method is interocclusal check records. Interocclusal check records. In this, basically during the try-in or the basically during the denture insertion, we use aloe wax, which is placed on the mandibular rim. Then we ask the patient to bite but not bite through the material, and then the recording material is set. The trial dentures are then removed and then transferred. Alright, if there is if the previous recording is same as the CR which is recorded now, then both the condylar elements of the articulator will contact and centric spots stops. That is the articulated cast. It will not it there is no need to move it to the intraocclusal check record. But if it stops on one, uh, basically it stops it does not basically if the any of the elements, one or both the elements are wrong, so the centric stops will not be in contact. All right, so this method is basically indicated in where there are abnormal related jaws, displaceable flabby tissues, large tongue, uncontrolled mandibular movement. Now, in functional method, we have needle house method. In this, basically, we have something like this, alright, maxillary occlusal rim, and we attach styli to the maxillary occlusal rim. Then, we take the mandibular rim and we ask the patient to retrude and perform functional movements. Then, we achieve tracings on the mandibular rim. Now the tracing towards which will be the first one will be the centric relation. Similarly, it is the Peterson method. In this, basically, we get a rhomboid. This gives us the relationship between maximum intercuspation position and the centric relation. Then in graphic tracing. Now in graphic tracing, we have two types. One is the pantographic and another is the Gothic arch, pantographic. Now pantographic is used to record the relations in three planes, whereas the Gothic arch tracing is only in one plane, that also horizontal plane. Now in this, what we do is to one rim, we attach the stylus, and to another rim we attach the plate. Then we ask the patient to perform protrusive and laterotrusive movements towards left and right, and then we see that we get a arch. In this relation tells us the centric relation. This is the laterotrusive movements towards left and right, and this is the protrusive record. Now, there are certain three types mainly of errors that are seen. One is in which there will be a rounded apex. Second is there will be a double apex. And the third one is there is going to be fading in the protrusive record. Over here, when we have a rounded apex, we basically come to know that the patient has a poor laterotrusive movement. So, we will ask the patient to train more. If we receive double arrows, or if we receive faded protrusive record, in double arrow, we get to know that the patient has a habitual retrusive closure of mandible. In both the in three this in both in three in these all the three scenarios, we will ask the patient to train more. Now, what is eccentric relation? Eccentric relation is any relation which is far away from the centric relation. Now, eccentric also again protrusive, laterotrusive, right and left. All right. Now, in Gothic arch tracing, it is highly accurate, but since it is time consuming, not used. Now, in Gothic arch tracing, one more thing to remember is that we use an articulator which can transfer the tracings. Basically, in the Peterson method and all these methods, we will use house articulator. So this completes the horizontal jaw relation.